Hello there. It's good to have you join us on today's episode of Health and Environment Insights. I am Kemi Adeni. Today on the program, we're going to be having this discussion about open defecation in public places, especially as it regards Ondo State, and how to tackle this growing public health concern. Joining me in the studio today to have this conversation, I have with me Professor Mobolanle Oniya. He is a zoologist and a lecturer at the Department of Biology of the Federal University of Technology here in Akure. Professor, it's good to have you this
morning.
Thank
you very much, Kenny. Good morning.
Thank you so much indeed for joining
us.
It's
a pleasure. Always a pleasure.
And so I'd like you to set the tone by defining what open defecation is.
Okay. Open defecation is a practice, or maybe an act, where people relieve themselves in the streets, by the roadsides, anywhere apart from any septic confinements. So once you do it in the open, that will call open defecation, and it's a menace presently globally, not only in Nigeria.
All right. Now, because you said it's a global concern,
yes,
but of course it's a public health concern. And for some of us, we usually would assume that it happens only in the rural areas. How do you explain why and how people would also carry this act out at the urban areas?
It's a behavioral thing.
Okay.
And one of the greatest challenges in public health disease management is human behavior. That is the greatest problem we have. Even when you have the antidotes to control these diseases, the human behavior aspect makes it very, very difficult to achieve. Now, for open defecation, there are a lot of reasons that are responsible for that. Now, some of the landlords who have rented apartments, particularly those these face me, I face you setup, some of them don't have toilets built with it. They have an outdoor open latrine, maybe a big system, and some tenants there may not like it because it's not properly maintained, the hygiene. So they will choose to go into the nearby bush to relieve themselves. Now, even in public offices, or institutions where you have offices and there's a toilet there, we human beings also have this kind of behavior towards using public facilities. We are very, very careless with it. We are dirty with it, and we don't take care of it as if it's our own personal property. We just abuse it anyhow. So if it's a public toilet and somebody uses it and abuses it, the next person coming may not find it comfortable to use the place. So therefore, it looks for the nearest bush and squat to relieve him or herself. Now, aside that, some have personal disdain for sharing public toilets, even if it is clean. They have that disdain that they could contract some diseases, some venereal disease from using the place. Some have this apathy towards sharing convenience. So when you have people like that as well, and they get pressed, they will look for where they can. So open defecation is very, very popular in urban settlements now. Very, very popular. Very, very.
Now, from your perspective as a professor who would carry out research, how widespread is this public health concern?
Globally now.
Yes.
Nigeria tops the list of the countries that practice open defecation.
Really?
Yes, with about 18%. About 50 million Nigerians, are projected to be practicing open defecation. It used to be India, but we're taking the first place now. Now, countries that rank top with these practices are those that have a heavy population. India, China, then we come. Well, you can't compare population to that of China. We're about 20 million or there, but still, congestion is a problem. It's a big, big problem. And then when that comes to, like I said earlier, human behavior is another significant thing that is more or less making it difficult to control. Now, within the urban settlements, you won't be surprised that if I do a small research in your facility, I'm sorry, I may come up with some interesting reasons that you will not be aware of. Because there could be some of your staff as well who would not like to share the toilet facilities in this particular place.
But I bet there won't be open defecation history here.
I'm just hypothetically. Because we find these things where you least expect to find them, because nobody's looking out for them. But we who know what we're looking for know where to look and uncover this. I'm just trying to say that if Nigeria tops the list globally now, it's a common practice.
Now, so before we come to asking you or having this discussion about what are the possible solutions to these challenges, I'll first like to ask you, what are the health risks that this would open us to, that we can be subjected to?
Apart from the obvious unethical siting of the
That is so awful.
Exactly, very, very indeed. There are a lot of health implications. That's why it's a public health problem. Now, by practicing open defecation, if anyone has some form of parasites, right, within the body system, some of these parasites are transmitted through their eggs that are extruded in feces. So when you do this and you put them in the open, you are making other people vulnerable to contract that disease. So you have communicable disease transmission, which is very, very possible. And there are quite a host of them, really. You'll be amazed, quite a host of them.
You just mentioned a few.
Okay, the common roundworm, ascaris, which is more or less, we are close to about, in a population of children, close to about 70% may be infected at one particular point in time. And globally, ascaris and hookworm, right, share close to about 1 billion infected people globally. So that is the easiest one to get transmitted through open defecation because we call them soil-transmitted emithiasis. So these diseases are transmitted through the soil. And once the feces gets onto the soil, that is when the transmission starts. And there are others too, strongyloidiasis, tiniasis, there are a host of them. So it actually leads to disease transmission. And some of these diseases, we call them neglected tropical disease entities. And we are still we are battling to stop to eliminate them by 2030. That is, I think, 5 years from now. Going at this rate of open defecation, the soil-transmitted helminthiasis under NCDs will have a challenge if we don't stop it. So we really have to stop it. So it's a real public health concern. Yes.
Now, as a professor, what ways can we sensitize the public? What solutions can we provide to these problems?
Well, the problems are one, political, and on the other part is sociology.
How do you mean political?
Thank you. Government needs to step up its game in providing what we call WASH. WASH is an acronym for water, sanitation, and hygiene.
Okay.
Right. Not only in public schools, because a good number of public schools lack those facilities.
Right.
At times you go to public primary schools, public secondary schools, they don't have a functional toilet. So the pupils and staff have to seek solace in nearby
areas.
Exactly. So the government has to make sure that WASH, right, is actually functional in all public primary and secondary schools in the state. And that is a huge investment. I want to talk about toilet facilities. We, at this age in time, we're not talking about the pit lateral system. We want the water closet system, where after you finish, you can just push a button and flush and goes into a septic tank. Now, apart from the schools, even in public places, you hardly see public toilets situated.
I was just about saying,
yes,
it doesn't have to be limited to schools.
You don't see public toilets situated in strategic places around.
Especially places where food is being sold.
Exactly.
And all
there was a time a friend of mine came to Akure and stopped at a roadblock. Yeah. So I was coming to pick him up. But he got pressed at a point in time and
needed inconvenience.
So he had to go into Chicken Republic, buy some snack to use that
so he can have access
to the toilet.
To the washroom.
Exactly. So he wasn't really needing the snack, but he wanted an excuse to use the washroom. So you could imagine if that facility was not nearby where he dropped from the bus. What would he have done? He would look for a nearest convenient place to, because it's an involuntary urge. Once you have the urge to do, when you have to go, you just have to go. You can't hold it. Yeah. So the sociology part is the human behavior.
Okay.
Right. And that is the most difficult public health issue to manage or control. My concept is my concept. My belief is my belief.
Okay.
If you get some rural areas, they are so wired to believe that if they don't do it outside, they can't be comfortable. Right. But there are still some little ways you can manage that, even though they do it outside. Rather than put it on the surface, you could pick a machete and dig some hole fairly deep
in the soil,
drop it here and then cover it up. Right. That could be the not acceptable but the worst condition that you can think of, rather than put it on the soil surface.
Okay.
But here, those who are urged and practice it, is not something that they expect to happen. So they don't have a machete with them.
Exactly. For someone who is traveling, for instance, on the road.
Exactly. You just do it on the surface and then you
go away.
You move on. Right. And also, I should also add this part.
Okay.
One of the consequences is also what we call zoonosis. Because zoonosis are the diseases that are transmissible between man and animal.
Okay.
So we share common parasitic biota. So animals also share. So even if you are able to eliminate that parasitic power in the human host, for as long as there are some animal hosts who live nearby, right, that are with you, and they pick it up, if they also defecate again, it can come back to man. I want to
for some of our domestic pets.
I'm going there, right? Dogs, pigs, right, particularly dogs and pigs. There are zoonotic infections that can move between man and dog on account of poor management of their feces.
Interesting. So that means that you're lending a voice to those who have dogs and pigs around them. They should be aware that that is going to that's going to really affect them.
Very careful.
Okay. Now I want us to talk about
And
places
cats too.
and cats as
And
well.
cats, yes.
All right. I know that as Africans, some of us really have a misconstrued fact about cats. So I'll let cats speak. Now I want to ask you: there are public places. You mentioned schools. There are public places. Places of worship, for instance, are public places as well. In what way are we going to sensitize the public to ensure that for all of these public places, especially when you mentioned the political aspect of the political angle of handling this problem, in what way can we sensitize the public so they would know that for all of these public places, it is mandatory to have some form of confidence where people can relieve themselves?
Without being sarcastic or actually being too tough.
Okay.
By attitude,
Yes.
Nigerians don't take to corrections easily. Right. We
We're
have
not
that.
easily persuaded.
No, we are not. We have that kind of a trait, really. If you tell them go left, they will say,
You want
"No,
to try right
Why
first."
must I go left?" Okay, so we have that attitude. But within the confines of the government,
Yes.
they have the Ministry of Health.
Okay.
Right.
I'd like you to hold on a moment because we'll return to this conversation,
All right.
especially this particular question.
Right.
And so we'll go on a break now. When we return, this conversation will continue. Please stay with us. I've been having conversation with Professor Mobolanle Oniya on this menace of open defecation. Prof, let's take it off from where we left off.
Yes, I said the government confines have the Federal Ministry of Health.
All right.
And we should rather talk of enforcement rather than to encourage people to actually stop open defecation.
You prefer enforcement than
Enforcement,
persuasive messages?
the two can go side by side.
All right.
So I think more of enforcement will do the magic. Now, I remember some couple of decades ago,
All right.
we had in Nigeria here,
Okay.
environmental sanitation officers that were called Wuli Wuli. Right.
All right.
There was the time in the history of Nigeria they were very efficient.
Yeah, we grew
And
up.
people were afraid of them. Once you see them coming, you start running. You look at your gutters, you clean them, you check your house that the waters are not turbid or dirty. I mean,
Exactly.
you do a lot
You
of
visit
things.
the marketplace.
Exactly. And you're always afraid of Wule Wule. But the effect of the officers seems to have waned in this current time that we are now. Now, the environmental sanction officers, the officers are those responsible to ensure that houses within municipalities have functional toilets.
Yes.
And that will also go to the churches and mosques that you mentioned, because it's actually against the law to build any structure, whether residential, whether office, or whatever purpose, without a toilet attached to it. And not just any kind of toilet, a functional toilet that has running water.
And also, when people have social events, when they have social function, some people don't even use a confined area like a hall. They sometimes would prefer to have it at an open field. In such situations, what are the guests supposed to do? Because we know for a fact that the best they most often will do is sneak out, get to the back of maybe a car or maybe the building and just relieve themselves.
Yes.
In such situations, what steps do you think government can take?
There are provisions.
And individuals as well.
I think the event planners, the onus lies on the event planners to ensure that if there is an open field, they must factor in a toilet.
Mobile toilets.
Exactly. So if it's a school that has the open field and they have functional toilets, they may have discussed with the proprietor of the school to make the toilets accessible for their guests. I've seen that in some private schools that have such facilities. The premises were used for such parties or engagements. Now, if that is not available, there are mobile toilets that can be used. So if you don't have that option A, then the event planner should ensure that they get mobile toilets enough, right, that will be available for the guests that they are having, and that will take your bit as well. So the options are there rather than doing it in the open.
Okay, I know open defecation is a choice. It's an involuntary action, and the choice that you probably would have is, the next available bush. Just like you have enumerated. But I'd like to say this: in what way can we champion a campaign? Especially in Ondo State. In what way can we champion a campaign, just like it's done at the national level, to sensitize the public, especially about the consequences of their action?
The campaigns are very expensive.
Okay.
Right. So an individual may not be able to do that on his own.
Yes.
If you have a wealthy philanthropist that is interested in helping government in doing this, very good.
All right.
But you want to point fingers that it's also a government responsibility for us to achieve the status we call ODF free. ODF means open defecation free.
Okay.
Right, to achieve that status,
Yes.
which is what we are all trying to aim at. So the campaigns are most likely on social media, right, audiovisual outlets, right, even the tabloids as well, whatever medium that can be used to talk to the public, right, even IC materials, posters, banners, and things like that. Yeah. At the roadblock junction here, you will see banners of political interests.
Yeah.
You will see banners of public health interests.
True.
Right.
Very true.
So those things, if they are placed as strategic places, as people drive past, it will sink into their consciousness gradually. And the more you see a particular, in psychology, the more you see a particular item, the more it hits you. The more it hits you, the more it hits you.
True.
If you see it once, you may forget it. But if you see it every day,
It registers.
it registers.
Yes.
And then that could bring some consciousness.
Okay.
But you hardly see public health banners around on those days. So the campaign is expensive, but it can be done. But to take time to get to that test, but it has to start. Right now, we are almost at 0.0 as far as open defecation is concerned in those states.
Okay, now let's take it away from the government level. Fundamentally, as human beings, in our various communities, in what way can community leaders, for example, we have local government chairmen, we have leaders of thoughts in various communities. As a matter of fact, we have resident association leaders. In what way can these people play some form of role in sensitizing their immediate community?
Thank you very much for that, because dovetailing now to community level is also an important aspect in terms of control. Let me start with the resident, or let me say the homeowners association, or we call landlords association. I think it's now a culture that probably on the day of environmental sanitation, most communities have their homeowners association meetings that morning of the sanitation day, and it's a good medium to actually propagate this matter as well for them to stop. So if the community members discover that in their neighborhood people practice open defecation, it should be brought to the community meeting, and then they enact a law, right, that in this community this practice has to stop. Where I live, we've not seen that, because of my field as a public health scientist, I'm always very conscious of things like that. I've not seen that. But where I live, we have issues with animals that roam the streets. So we enacted a law that animal owners should not let their animals go free range. They should keep them within their houses. If you cannot do it, sell them off. Right.
So it is prohibited.
Exactly. So if you have somebody doing open defecation to your area, the landlords can enact such a law, and it becomes kind of a practice, and gradually they get used to it, that I can't do this on the streets
not acceptable
in the neighborhood. Then for the local government, what applies to the state government applies to the federal government, applies to the local government. It's also part of political structure. So they should also make sure that their campaign at that level, which is a smaller confine,
and they are more accessible to the grassroots.
Exactly.
All right. Now, Prof, as a parasitologist, what health education strategy would you say, can you advise us to adopt in getting rid of this menace?
Open defecation.
Yes.
I think the summary is still what I call WASH: water, sanitation, and hygiene.
Okay, since you're going through that route, I'd like you to wrap up, giving us your final words on WASH. I really am interested in WASH. It seems like it's going to be an acronym that we can learn quickly.
Okay, let me repeat. WASH is water, sanitation, and hygiene. Right. So these three things are part of WHO's view, agenda, technicality, right, to ensure that we, to a lot of extent, eradicate globally some certain diseases, right, just by practicing water, sanitation, and hygiene. Water means that wherever you are, residential, office,
ensure that there's water.
And not just water, it is supposed to be running water.
Right.
If you don't have access to pipe-on water that runs through the faucet, right, you could improvise by using some kegs. We call it tipita.
All right.
But it must be running water. So that the idea